The hopes that you bring, the dreams that you share, the pleasure you get when you know that we care, the faith that you place, the trust that we share, the joy in your heart when you know that we care. You before we, as USV, you before we, as USV.
USV, your reliable healthcare partner.
Hello viewers, welcome to another episode of Beat Diabetes. Diabetes is a household word in India. All of us have to learn how to live with it. Don't think of diabetes as a disease like, malaria or typhoid or cholera. It's not something that can be treated by the doctor and you'll be sent back home. Diabetes is a condition with which we have to live all our lives. And if we follow the basic principles, it's possible to lead a wonderful and healthy life despite having diabetes. So to answer all your questions, to tell you how to live with diabetes, we have two senior experts with us today, Dr. Avdesh Kumar Singh from the GD Diabetes Center in Kolkata and Dr. Beena Bansal from Medanta Medicity in Gurgaon. And we also have this lovely studio audience who are here, and we'll try to answer all your questions too. Thank you very much for being here. So let's start with Dr. Singh. And one of the things that we all see in our practice is when you break the news to the patient, well, you have diabetes. That's like sometimes a shattering experience. Do you feel the same thing in your practice?
Yeah, exactly. So we do encounter to a spectrum of patients' behavior once you are detected diabetes for the first time. So someone is in denial mode, has detected diabetes, and he keeps on testing, going to different lab. Once you are detected diabetes, you are diabetic. You can recheck. That's a rule. And there is another extreme that someone develop diabetes and then he become completely obsessive of making it dawn. So keep on checking blood sugars every time, 6-7 times per day. The fact remains is we need to educate them that once you have developed diabetes, there is no issue. We can treat you, you can control your blood sugar, and one should not be obsessive about keep on checking blood sugars either in a denial mode or in the obsessive mode.
I think that's a very good message, that we need to strike a balance. And what I always tell my patients is, you follow a lifestyle which is going to be pragmatic for you, which you're going to follow, which you can follow rest of your life. Drastic changes are not necessarily going to last out and not necessarily going to help you in the long run. So the other challenge we face, Dr. Bansal, very often is that, you've explained to the patient about the disease and the patient is now convinced, yes, I have diabetes, and knows that I require some treatment, but says no medication. So why do patients resist medication? What's your experience in this?
Yeah, so I think that's a common scenario in diabetes, because diabetes is a disease when patients do not feel any symptoms. Unlike pain or fever, for which they would readily take a medicine, for some disease in which they do not have any symptoms and there are no perceived benefits, they would not want to take any medicines. Also, there is undue fear of side effects of the medications. So it's important to explain to the patient the need to take medicines. We know that medications help in producing a good glycemic control and preventing complications which are very costly to treat. So the reason to take medicines for diabetes now is to prevent symptoms in future.
Patients, as you said yourself, are often afraid of side effects. That's one question. So should we really be worried about side effects of medication?
Any side effect of high blood glucose, even mildly high glucose level, which patients consider as mild, over a long period of time can cause slight damage which accumulates over years to bring complications in organs. They can damage organs which is irreversible and very costly to treat. So any side effect of high sugars is definitely much more than any side effects of medications, which are mostly proven to be safe.
Most drugs that are used for treating diabetes or other chronic conditions have been studied extensively, and they haven't come to you just out of the blue. There's a lot of data behind them, and you also know that there could be some minor potential side effects, but you know how to monitor. So if you're monitoring for your side effects in consultation with a doctor, you're pretty safe. Whereas with uncontrolled diabetes, as you know, you're bound to get into problems. Moving further on, we've diagnosed, convinced, started medication. Now the patient tells me, now I've started medication. Where is the need for all these strict discipline and everything? Why should I do this? I mean, now I'm on medication, now I'm under your charge. Your medication should fix me. How do you deal with that? Do you face that?
Medications is one of the treatment aspect of diabetes. Someone is diagnosed diabetes today, I don't prescribe medications on day one. We allow them to utilize the resources in terms of controlling diet, doing exercise. That's the integral part. It helps you in a multiple manner. It keeps you fit. It also helps you to make your medications works better. People do not understand that if you do exercise, the dose of medications which you are taking would be reduced to, let's say, 10, 20 to 50%. So diet and exercise, we call as lifestyle modification, is the integral part of treating diabetes.
But Dr. Bansal, we face this a lot. There are, despite whatever you may advise, and despite even patients who are doing very well, at least half my patients, some tell me, some don't tell me, but at least half my patients are taking other forms of therapy that I'm not even aware of. So they're taking some indigenous product, some preparation, something or the other. So what is your feel about these so-called alternative therapies, which are alternative to Western allopathic medicine?
So my feel is that I would want patients to take any medicine which is effective and safe.
Yes.
And the artificially created divide nowadays between Ayurvedic and allopathic medicine is actually very artificial. There is no clear division as such, because if we see the most commonly used allopathic medicine for diabetes is metformin, which is actually derived from plants, which has been proven to be safe and being used over last 50 years. Lots of scientific data is available for that, so we confidently use that medicine. Whereas if you give me a medicine which I don't know whether it's effective or not, just studies on rats or studies on a few number of patients doesn't mean a good effective trial. It has to be a robust scientific evidence to say that it is effective and it is safe. And then there's no divide. We can use any medicine.
So I think the message from your experts is very clear. We want medications that will help our patients. We are all on the same side. I'm sure there's a lot of richness, goodness in ancient medication, in Ayurvedic medication also, which has not been tested enough in the modern context. We would like such results to come out so that we are better empowered to take care of our patients. So I think that's the way we would look at it. And once we've decided that we are treating our patient, everything is on track, patient is doing well, now patient wonders whether he should still continue to be in touch with Dr. Singh or Dr. Bansal.
See, the treatment of diabetes is not the glucose centric or blood sugar centric. 60 to 70% of diabetes will have concomitant high blood pressure. 60 to 65% of them will have bad cholesterols. You need to consult your doctor, not every day, not every monthly, but there has to be a reasonable time. We call it as a 3-monthly checkup. If your blood sugar is reasonably well, go to your doctor, get your average of blood sugar get controlled. So we have got average of blood glucose we call as a glycated hemoglobin that needs to be checked every 3 monthly. And the glycated hemoglobin is your tissue glucose, which actually suggests whether you are going to develop any complications of diabetes. But you need to go to your doctor at least at 3-month interval to check your blood pressure, your cholesterol, and to look for any complications you are developing.
So last question, Dr. Bansal, before we open up to our very interested and bright audience, and that question is about the same thing actually. So what do you think is the patient's role in, we've been talking about it, what do you think really is the patient's role in managing their own condition? I mean, they should take their medicine, of course, they should visit the doctor. What is their overall role?
So diabetes, as we have discussed and we understand, involves lots of day-to-day management. It's the patient who takes everyday decisions about what they are going to cook and eat, how they are going to exercise throughout the day, whether they are going to get up early in the morning and go for a walk or not. So these decisions a doctor cannot take in this office. The number of hours you'll meet a doctor in a whole year is really small as compared to the number of hours you'll spend with yourself and your own decisions. You have to take decision about taking medicines on time, how you'll incorporate that into your day-to-day routine. Also, it's very, very important to incorporate monitoring of blood glucose into your regime. Depending on what medications you're taking, you may need to check your glucose monthly, weekly or daily 4 times a day, depending on what you're taking. So as advised by your healthcare physician, as advised by your doctor, and after understanding the disease, you need to take the decisions yourself. You should be confident enough, empowered enough to be able to take those decisions every day. In fact, diabetes management also involves some bit of medical knowledge in terms of insulin adjustment, for example. A lot of things depend on how much the patients know about their disease.
I completely agree. I think patient involvement in their own management is the key in diabetes. Many years ago, Elliot Jocelyn said, the diabetes who knows most lives the longest. And I always use this sort of cliched point that really the relationship between a doctor and a patient with diabetes is that of a coach and a player. And really, if you have to play the game, the doctor is only your guide. We'll take a short break and be back after the break to take questions from our audience.
The homes that you bring, the dreams that you share, the pleasure you get when you know that we care, the faith that you place, the trust that we share, the joy in your heart when you know that we care. You before we, at USV. You before we, at USV.
USV, your reliable healthcare partner.
Welcome back. And now we open up this program for questions from our audience. Any questions, please, ma'am?
Hello doctor, I am Reema. I am recently diagnosed with diabetes and my question is, should we start insulin from day one or as per the general like it is given at a later stage?
Is it okay to start or insulin is the last resort?
Well, so let the doctor treating you, decide whether you need insulin. So one should not fear if your physician has prescribed you insulin on day one. Remember, if someone has got very high blood sugar, someone having the symptoms of diabetes, especially we call as a osmotic symptoms of diabetes, means frequent urination, increased thirst, someone having too much of eating habit, we call polyphagia. If you have got these 3 symptoms of diabetes, with your blood sugar ranging in a very high range, maybe you can say ranging from 350 to 400, your doctor is going to give you insulin. But then people feels that once you have started insulin, you will be given for whole life. That's
a big
not
fear.
the case.
That's a big fear. Yes.
That's a big fear. Once your sugar is controlled, so someone has started you on insulin, once your sugar comes down, your doctor will stop insulin and they will put you on the tablets. Moment your symptoms has gone, your blood sugar has gone down. So it's not the the early or the late, it should be the timely insulin therapy.
So very, very important messages, which means don't be scared of insulin. Follow your doctor's advice. Let's move to the next question.
I'm Savita Kaul from Gurgaon. I'm having diabetes from last 16 years. I believe diabetes leads to a lot of food problems. How do we prevent that?
So it's a very relevant question for you, Dr. Bansal.
Diabetes causes nerve problems. So diabetes can damage nerves and also some effect on the blood vessels, through which foot ulcers or foot damage can happen. So if the patient is not able to feel properly, there is increased risk of getting injured. So foot injuries are common in patients with diabetes, and these can be prevented. So foot ulcer, foot gangrene, these are preventable complications of diabetes, and first and foremost we have to control diabetes well. Second is all patients with diabetes, and especially those where numbness of feet or there is involvement of nerves, by examination at the doctor's chamber, you should be inspecting your feet every day. Check your feet every day if required, using a mirror if you can't see the sole of the foot, because that happens so frequently that there is an injury and patient was not able to see that. They can't feel it and they don't see it. So using a mirror or asking someone else to inspect at least once a day, check for any redness, blisters, calluses. So any abnormality, any cut, just go and visit your doctor, because that can grow overnight. Overnight you can develop a full-blown gangrene in a person with diabetes, because the blood flow is not okay and the healing will not be that good. If sugars are high anyway, infection can suddenly increase. So night you sleep and the next day morning a full-blown gangrene can happen. So immediate visit to a doctor is required. Do not go without your footwear anywhere, especially the most common location where injuries happen is temples, for example. If the floor is hot, so hot concrete floor and you get blisters, it's actually common. Even some people have the habit of walking barefoot on the grass. You may not know, and there may be some broken glass or something, so that's not a good idea at all. In winters, if you are using heaters, if it's close enough, it can actually cause burns. When you wear a new shoe, there is a breaking in period, so a new shoe should not be worn for throughout the day. For example, shoe bites are one of the other common causes of foot injury.
So
these are
lots
some of the
things,
important
yeah. I mean,
precautions.
I think what you're saying is you've given a whole lot of tips, very valuable tips to protect one's feet, and I would say that actually this is the most preventable complication of diabetes. Do we have any more questions? Yes.
गुड मॉर्निंग डॉक्टर, मेरा नाम ध्रुव शर्मा है। मेरा क्वेश्चन है कि डायबिटीज़ पेशेंट को कितनी एक्सरसाइज और कौन सी एक्सरसाइज करनी चाहिए?
बहुत ही relevant question है. The question is about exercise. Dr. Singh, you want to answer that?
Well, as I said earlier, diet control and exercise is the integral part of diabetes. Whatever kind of medications you are, you need to have a regular exercise and diet control. The golden rule is, and it has been derived from several studies, that at least a diabetic patient, if you don't have any complications so far, should walk for 150 minutes per week. That translates to 30 minutes of a walk. It should be a brisk walk for 30 minutes for at least 5 days in a week. Again, people sometimes become obsessive, and many of my patients बोलते डॉक्टर साहब मैं 5 किलोमीटर रोज दौड़ता हूँ. मैं बोलता हूँ कि आप 30 minutes walk कीजिए. Brisk walking is good enough. And if you feel like that by just doing a 30 minutes walk give you a benefit, that doesn't translate that if you walk for 3 hours, this will multiply by 33 times. That's not the case. You will be fatigued and unduly you will be stressed. You might develop hypoglycemia if you exceed that limit. So 30 minutes of brisk walk per day, 5 days in a week, means 150 minutes in a week, will actually gives you a benefit which would translate into make you a fitter, stronger, and your medications works better without undue stress, undue chance of any hypoglycemia. There are ways of exercise, means you should do aerobic exercise. There are the exercise called resistance kind of exercise, that is for muscle building. If you don't have heart disease, if you don't have badly nerve disease or with a severe eye disease that can leads to retinal complications, you are fit to do a resistance exercise. That makes you even fitter, and it has came through several research why you need to walk at least 150 minutes in the week.
So having said that, and I totally agree with you, there are younger people who would do more than that and they are happy. So there's nothing wrong in doing more exercise, especially if you're in the early stages of diabetes. So it is that 150 minutes is what is recommended, and you must do that. If you are physically fit and young and you're a runner, for example, you're a marathon, you can be anything with diabetes. You can be a marathon runner, you can be a sportsman, athlete. So nothing stops you from doing that. Just tell your doctor, adjust your medication accordingly, and you can do anything in life. Yes.
I'm Subhashini Sharma. I am diabetic from the last 14 years. Today my question is this: I'm scared of low sugar.
Very good. You want to answer that? That's a very positive and nice.
Yeah, very nice.
Example.
Very happy to take these questions. Low blood sugar is one hindrance in treating diabetes. We are lucky that now we have got variety of newer medications which actually doesn't causes low blood sugar. Hypoglycemia is a hindrance, but now we have got a newly emerging medications which are very safe, doesn't causes hypoglycemia. We have got modern insulin which do not causes hypoglycemia to the extent as the conventional and older insulin. So one should not fear about that. Talk to your doctor, take a call in terms of using those medications
yes.
which causes less hypoglycemia. You can come out of the older medications which had a potential to cause hypoglycemia. So it is an issue, but nowadays at least we have got a chance to utilize those drugs.
So Dr. Bansal, how should a patient prevent hypoglycemia? What are the things one should keep in mind?
As Dr. Singh clearly said, that if someone is on medications which do not cause hypoglycemia, there is no fear. Actually, there are good lots of medicines. So initial prescription are usually with those medicines, and one can be assured that we don't have to bother about the low glucose, only the higher side we need to bother about. But there are medicines which can cause hypoglycemia as well. So then that's a tricky double-edged sword, and we need to take care of lower side as well as higher side of glucose, and therefore there is a target range which will be prescribed by a doctor. So if there are medications which can cause hypoglycemia, please check your glucose regularly, weekly or daily, and try and maintain that range as prescribed. Don't cross the lower side, but do not also cross the higher side of the range, because if low blood glucose can damage immediately, even higher blood glucose is unsafe and it can cause complications in future. So keeping that in mind, a realistic fear of hypoglycemia is required.
Basically what you're saying is a realistic sort of target, and also follow the principles of eating on time, taking the medicine on time, checking regularly, and you'll be spared of this risk of hypoglycemia or low blood sugar, as we call it. And I think we are coming towards the end. I'm getting reminders, and we still have some questions. Please.
I'm Vidya Jha. I'm diabetic from last 20 years. My question is, eating every day, egg is advisable or not?
Quick answer about egg. Dr. Bansal, you want to take that?
A whole egg which has egg white and egg yolk. So egg white you can take any amount every day. It's a good source of protein and recommended from 2 to 4, in fact higher amounts also one can take. Whereas egg yolk is something which is high in cholesterol, and therefore there was till now a taboo against taking whole egg by diabetes patients or patients with heart disease. But we now know that despite that cholesterol in the egg yolk, eating that doesn't increase blood cholesterol, and it doesn't lead to increased risk of heart disease. So moderate amount of egg yolk consumption, that is 1 per day, is allowed. Even for a person who has diabetes,
so
and it's good for health actually.
And I think we have time for one last question. Yes sir, please.
डॉक्टर साहब, मुझे 30 साल से डायबिटीज़ है, और डॉक्टर साहब एक चीज़ कन्फ्यूज़न की भ्रम की स्थिति हो जाती है कि फल सारे खा सकते हैं या नहीं खा सकते, या कुछ लोग कहते हैं कि आप सीजनल खा सकते हैं, बिना सीजन वाले नहीं खा सकते. इस बारे में आप मेरे को सलाह दीजिए.
So Dr. Singh, we want to close out with some sweet advice about summer fruits.
The fruits, is a nature's gift to the mankind. Every diabetic patient can have any fruits. There is no fruit which cannot be consumed by diabetic. That's number one. But what we need to understand, fruits are very good in terms of nutrients, vitamins, minerals. It contains 90 to 95% water. That's great, and contains much less calorie than the normal staple food which we take every day. So that's the best part. It contains fiber, which takes care of digestive system, our bowel habits. So that's the nature gifts to the mankind. Now what we need to learn is the calorie content of fruit. That's very important. हमें ये जानना जरूरी है कि how much proportion of fruit one should eat and how much calorie it provides. At the end of the day, calorie matters. For example, some fruits like banana or mango has got little higher calorie value compared to other fruits. For example, if you compare with papaya, if you compare with orange, they have got less calorie. Lekin then you have to cut calorie in other portions. You have to cut your chapati, you have to cut your rice. Calorie आपको लेना है, आप पूरा आम भी खा सकते हैं. But you need to cut calorie. At the end of the day, the entire day intake of calorie matters. उसमें that includes fruits as well. तो आप कोई भी fruits खा सकते हैं in a moderate quantity. There is no contraindication that diabetic patients should not eat this and that. You can eat anything, but in a moderate consumption. 100 grams of servings allowing you 15 grams of carbohydrate. 15 ग्राम carbohydrate fruits का आप ले सकते हैं per day किसी भी fruit का. There is no harm.
बहुत ही अच्छी एडवाइस दी आपने, बहुत ही सेन एडवाइस, प्रैक्टिकल एडवाइस और साइंटिफिकली साउंड एडवाइस जो हम लोग देते हैं अपने पेशेंट्स को. और फ्रूट जूस नहीं रेकमेंड करते हम लोग.
That's very important.
फ्रूट जूस में केवल चीनी ही रहती है. It's only sugar. Whole fruit is the thing that we recommend. And I think on this note we will end this wonderful program with this lively audience. and are very knowledgeable experts who have helped to answer many of their questions. Thank you very much. Bye.